size and neuromodulation, does it matter? The answer here is yes and no, and it really comes down to what are we talking about when we talk about size? Are we talking about the IPG? Are we talking about the size of the waveform? Are we talking about the electrodes? And there's a few different ways we can look at this. Initially, I was just going to really kind of talk about the cans, but I think there's a bit more to the whole conversation. So we'll start off with a little bit of a historical context, and then we'll kind of head into looking at the leads, the pulse generators, the dose and the waveform, and what are some future technologies that have to do with size specifically. And so to give us some historical context, right, if we think about it really with Scribonius, the first size had to do with, how big of a fish do you want to go into the deli? But as we kind of matured here, and the first implants were done for STS and PNS in 1967 and 1968 by Wall and Sweet and Seeley and Mortimer, these initial devices were actually decoupled, right? So